the worst chiropractor in the United States with a 1-star rating on their Google profile. Give me a few seconds, I'm heading to my clinic. Dr. Boivert, Canadian chiropractor, here to react to a YouTube video with over 1 million views. I'll break down the information presented and offer my perspective.
These are painless adjustments, okay?
My back has been killing me. Many people in the YouTube comments seem to have some kind of concern about my back.
It's important to understand that there's no need to panic when experiencing back pain, especially if the person in question likely spends a lot of time in a sedentary position, such as in front of a computer. Sedentary behavior is indeed one of the main risk factors for developing nonspecific lower back pain. Nothing is stuck, displaced, inflamed, or hidden. However, this area can become more sensitive, and the symptoms, discomforts, and pain serve to encourage preventive actions, getting up, moving, and engaging in physical activity. Therefore, it's crucial to increase the ratio of physical activity compared to the time spent in a sedentary position.
Many people in the YouTube comments seem to have some kind of concern about my back.
I recommend that anyone with concerns or fears consult a professional. However, it is essential to put neuro-musculoskeletal pain into perspective as much as possible. It is completely normal for a region of your body to become more sensitive or even painful after several hours of sitting or lying down without movement in a near vegetative state.
Okay, so I just came across Dr. Abel Rodriguez. Apparently he's a chiropractor, and he has a lot of 1-star reviews.
Abel Rodriguez is a glorified card reader. This approach he uses is no more than a very overpriced $140 magic trick.
I was looking to be adjusted, and instead he told me I need to forgive myself. The day after he did his energy healing and pretend adjustment, I had a terrible migraine and almost passed out reading a book to my son.
When I say that the placebo effect is very real, especially in the context of conservative therapies, we have a good example here. This person was specifically looking for an adjustment or manipulation.
I was looking to be adjusted.
But the practitioner did not meet their therapeutic expectations. Instead, they offered energy therapy.
Told us he didn't believe that chiropractic worked and that he now used energetic healing and kinesiology.
Which, by the way, is not common in North America. I want to emphasize that no chiropractor in North America should practice this type of method unless it aligns severely, and I really mean severely, with the patient's therapeutic value beliefs. As a result, the person began to suffer from migraines and difficulties reading, and it is essential to understand what energy therapy really is. It literally involves placing hands above a person without touching them, hoping that some kind of energy transfer will occur to heal them. Let's be clear, nothing happens in your body with this type of treatment. There is no energy transfer or healing process taking place. So if you experience side effects after this kind of intervention, it's likely due to a misunderstanding of what was happening. Perhaps your therapeutic values were not respected, or you accidentally associated symptoms that you would have felt later anyway, regardless of whether you received this therapy. Additionally, a negative placebo effect can sometimes amplify the perceived symptoms after such an experience.
And that he now used energetic healing and kinesiology.
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 The correct pronunciation is kinesiology, and I doubt it's more about applied kinesiology.
He totally cheated me. What he's doing with this scam is nothing short of evil and malpractice.
If you are looking for card reading nonsense, then this is your guy. If not, don't even bother.
If you don't crack anything, can you even call yourself a chiropractor?
Well, if I've heard anything about going to the chiropractor, it's that it usually results in some sort of wonderful crack.
The chiropractor can use various manual therapies or passive modalities to relieve neuro-musculoskeletal pain, and it is not always necessary to perform adjustments with cracking sounds to provide relief. It is essential to understand that there is no clear scientific consensus on the best manual technique for treating pain in the neck, back, or other areas of the body. The key element is to respect your therapeutic values, ensure that the proposed interventions provide more benefits than risks, and, most importantly, to fully understand your diagnosis. This allows you to maintain your autonomy and follow our recommendations outside of the clinic. In the clinic, I rarely treat the neck with chiropractic adjustments, which is just a fancy way to put a branding on general spinal manipulations. Instead, I use progressive mobilizations that involve working on the range of motion, rotation, flexion, etc., while introducing resistance. These techniques produce results as effective as a manual adjustment of the neck. Additionally, many patients are hesitant to receive cervical manipulations, so it would be inappropriate to force this intervention on them.
After him just laying 2 fingers on me all over, he said he was done.
Caused a vertebrae in my neck to go out from the muscle testing, which caused severe headaches and had to be put back in by another chiropractor.
I've repeated it several times in my videos. The displaced vertebra that would bring you to chiropractic doesn't exist.
Caused a vertebrae in my neck to go out from the muscle testing.
If our vertebrae could move that easily, we would see hockey or football players becoming paraplegic with every collision. In other words, it is impossible for muscle tests to displace a vertebra in your back,
which caused severe headaches and had to be put back in by another chiropractor.
This is likely a misunderstanding or a clumsy explanation from the chiropractor who wanted to justify manual treatments by incorrectly explaining the persistence of pain. Once again, it seems that, aside from a few muscle tests, this person did not receive any real treatment, but rather energy therapy accompanied by a negative placebo effect. It is important to understand that a placebo effect can be both positive and negative, and in this case, the negative placebo effect may have amplified this person's symptoms after the session. However, it is also possible that even without this therapy, the same symptoms would have manifested. What is certain,
caused a vertebrae in my neck to go out from the muscle testing,
is that this is absolutely not related to a displaced vertebra
to be put back in by another chiropractor,
nor to a problem that could have been fixed by another chiropractor by putting it back. The idea of a displaced vertebra is a misunderstanding that does not align with the biological reality of the human body.
So if that involves, letting this person, try out some kinesiology on my back, then I'm gonna fucking do that. And hope for the best when it comes to my back. Because I sure could use a fixing.
What I'm about to say may seem trivial,
a fixing,
but it is crucial to pay attention to the terms we use, such as the concepts of correcting, fixing,
a fixing,
or repairing your back. You don't have any defective parts in your back, and most importantly, no therapist can repair them for you. Additionally, using derogatory terms like these
a fixing
in the context of health can lead to hypersensitivity and even negative neuroplasticity, where your brain, spinal cord, and the affected area become more sensitive over time. Words like repair, fragile, or injured are pejorative,
a fixing,
and can gradually strip you of your autonomy regarding your health. This opens the door to therapeutic dependence, where it becomes inconceivable to believe that one can manage without regular treatment.
As they say, you are as young as your spine is flexible. But in my profession, 1-star reviews are not something I can be flexible with. I need to experience the service for myself. I was on a mission, and I have no problem putting my physical well-being on the line in pursuit of the truth.
The video isn't over yet, so if you want to see what's coming next, the link should pop up live now. In the meantime, feel free to share your experiences, comments, suggestions, or ask me any questions you may have. Oh, and don't forget to click for the continuation.